While the COVID infection rate is going down, one thing is not.
Alcohol consumption continues to rise, and much of that is due to the world that the coronavirus created. But it's affecting one group of people more than others. In April of this year, North Carolina saw liquor purchases grow 16.6% compared to the same time last year.
Certainly concerning. We know that heavy alcohol use can have a number of consequences. It can affect physical health, mental health, cause increased sleep problems, a decreased immune system.
Alarmingly, women are seeing the greatest spike. A study last fall by the Journal of the American Medical Association found the amount of women drinking 4 or more drinks within a few hours jumped 41%. COVID and social media are partly to blame, says clinical addiction specialist Heather Gallagher.
Whether it was a after-work happy hour with college friends, or yoga with wine, or book club with wine. A lot of that was paired with drinking.
Much of that drinking, Gallagher says, is due to COVID-induced stress.
Trying to work from home and teach kids from home. There's financial uncertainty. There's anxiety and fear about COVID in general, or medical illnesses. Isolation, we can't do things that we used to do, unemployment possibly.
And as those concerns begin to ease and we get closer to normal, the numbers aren't going in the right direction when it comes to alcohol, and the chance of addiction only increases.
So people going back into the world with any or all of those is going to be problematic for them, for their family, for their coworkers. So I think we could potentially see a lot of problems.
So if you are struggling with alcohol and want someone to talk to, here's the number at the bottom of your screen for Alcoholics Anonymous. That's the regional number here. It goes for women, men, non-binary, anyone who needs help. I put a lot of resources at CBS17.com. Also consider a counselor, just like Heather.
Unfortunately, it doesn't surprise me, given what has happened in the last year or so.
And, you know, you want everybody to get help and the help they need.
Good job.
For their families and themselves.